So welcome back. So on the journey of being diagnosed with hyperparathyroidism, this is part two. Part one I went over until I was diagnosed with it, and now part two is meeting the endocrinologist. So I told you in the last video that this year, 2025, I was diagnosed officially with hyperparathyroidism, primary hyperparathyroidism. And so in between May, my doctor put a referral in for endocrinology, and that took 6 weeks to get in to see the endocrinologist. In the meantime, they drew more labs, rechecked my parathyroid level, which then increased to 90 something. My calcium dropped a little bit, but it was still high and elevated, okay? In the meantime, I had to do a DEXA scan, which checks your bone for osteoporosis. So I had that done. Now, thank goodness my DEXA scan is normal. At this point, I don't have osteoporosis, even though I have massive bone pain, but I don't have osteoporosis, although it's been 9 years since my first elevated calcium. So I'm very thankful that that DEXA scan was okay. So that is where we were at until I met the endocrinologist. So my husband and I went to the appointment in mid-June, asked a lot of questions. Basically, he just asked my symptoms, how long I've been dealing with this. I had put together an Excel spreadsheet. I presented that in an email to him, and he attached that to my chart because he said it was very impressive because it went through all my symptoms. I went through every note I had, why I was there in the last 9 years, and every time they drew a calcium, and every time it was elevated, and every time they did nothing. So when we met him, he said, that is quite impressive, my spreadsheet. I'm a nurse. I'm a mom of 7. Like, hello. Yeah, it's going to be, right? I'm pretty organized. So he basically asked me my symptoms and basically had said, yes, you have hyperparathyroidism and we need to remove the gland or whatever, one of the 4 glands, or usually it's one gland of the 4 parathyroid glands. Sometimes it can be more, but usually it's one. And what I was diagnosed with was that, okay? So then he basically tells us that we have to have surgery. Or I have to have surgery. My husband, it's like when I was pregnant, we are having a baby. No, I'm having a baby, but he's with me, right? Just like at the appointment, I'm having surgery, but he's there to support me, okay? So anyway, so I will tell you that I cried at that visit because after 9 years, I wasn't just feeling all these symptoms. There was a reason behind my symptoms. It wasn't just because. Like, there was a because. It's because I've been battling something that you can't just see. I thought I was a good advocate for my son when he was having seizures and, through his death, and helping my sister with her breast cancer diagnosis, helping her navigate through that. I thought I was fighting for myself, but it took 9 years to find a doctor who actually listened instead of saying it was my grief, my anxiety, my loss. And when the endocrinologist said my symptoms are pretty much what it is, I just felt relief and anger and sadness, like loss again, or like going through the stages of grief because I was so angry that for how long I have been ignored. And my whole point in this is hopefully this will help you. And maybe you got diagnosed right away, and maybe that you're kind of like, luckily you had a doctor that listened to you. But I've watched some videos and I think it does get missed quite a bit. So we met him. He's great. We really like him. He's educational. I mean, like, he does a good job teaching. He's personable. He's got a good manner. Okay. So I thought, okay, well, do you do the surgery or what's the next step? So then he tells us he has a few more things he wants to do. They drew a cortisol level. They drew some other labs just to make sure like nothing was going on from my postpartum hemorrhage, that I didn't have some pituitary involvement. So he did a bunch of other expensive tests. And then he ordered a ultrasound of my thyroid and parathyroid glands. And then he ordered I'm going to have to put the nuclear med scan. I don't know what it is, but it's a nuclear med, and I'll insert photos of mine, and it's very grainy and weird, and like it's not like a clear picture, but what happens, they inject you with this isotope, and then because it goes through your heart, the first scan has to be done at different times. So like you go in there and literally you're in not a tube, but like you're in that, if you've had an MRI or something, you lay flat and then they papoose you in. But with this scan, the machine comes like literally like inches from my face. And he's like, are you claustrophobic? I'm like, well, no, I've had MRIs, but Okay, you have to sit there for 15 minutes. Well, it just makes all these noises and all that kind of stuff. I just didn't like that it was so dang close to my face. So I just had to close my eyes and pray and talk to God the whole time because I just didn't like it. And then I had to wait another. So then I went and had my ultrasound done. And then I came back 15 minutes or 30 minutes later and they had to do another scan. And then the last part of the scan I had was, I think like an hour or so later, because then it's passed primarily through your heart. Because when you look at the picture, the heart is really bright. And then there's some parts in your cavities in your brain, I can't remember what light up with it too, or I don't remember. So they do multiple phases of the scan so that they can make sure that they're seeing it and what is actually lighting up. And then the last part of it is because the parathyroids hold on to the isotopes the longest. So the last scan I had to sit like this for like 30 minutes, and then I had to turn my head for 15 minutes this way and my head for the 15 minutes this way. All the time this stupid board like this big is above my face, like literally you're staring at it and you just want to scream and be like, get me the heck out of here. So did that, and then when I was turning my head to this way, I could see his screen, and that's when I realized that I've had this pain on my right side for the last several years. Like I've thought I had like some kind of bone cancer or something weird or cancer because of my sister's breast cancer. I thought I've got to have something terrible up here, right? But when I turned my head, I really got tearful because I realized that the parathyroid gland that I believe I can see lit out of the four is right here on my right side. So in that moment, I knew, and I know my doctor, when I talked to him after my scans, which I'll talk about, he said he doesn't think that this pain on my right side is from my parathyroid gland, but I am going to dispute that. I talked to my chiropractor and she's like, because I saw her in middle of this, she's like, I bet it's going to be, because she even couldn't figure out why I'm having all this pain right in my neck, literally just right here. So weird, right? The last couple of years. So as soon as I saw that one on my right side, I knew where it was. I was like, yep, that's exactly it. And then when I did my ultrasound, I wasn't watching because she had it kind of turned and I could see the vein and the artery, whatever was, by your neck here, right? Okay. But I was just really not paying attention. As soon as I saw that scan from the isotopes, I knew that that was the right side. So, oops, sorry. So then 2 weeks later, in the meantime, between seeing my endocrinologist mid-June, he made an appointment for 3 weeks. He said, you should be able to do labs and get both of those scans done before you see me in 3 weeks. Now, my darn insurance, because that one scan was like $4,300 and the other ultrasound was like $2,000. Like, how are they so expensive? So we have insurance, but of course it had to go through pre-approval. So that was kind of what the holdup was. So a couple days later, I was already seeing the endocrinologist again. So my husband and I met with him and he's like, yep, so you need surgery. It's like, okay. Like I knew that was it, but I just was like, he's like, you're healthy, you're young, you have so many years ahead of you. Don't you just want to feel better? We need to just take it out. And I'm like, you know what? I do want to feel better. I do. Okay. So we know where we're going with this, right? So then he says, okay, I'm going to put a referral in for my surgeon and this is who I want you to have it done. I send all my parathyroid patients to him, and I'm like, okay, whatever. So he says, I'll put the referral in. If you don't hear anything in a week, then call or send a message through the portal and I will personally call him. We play golf together, whatever. Okay. So I'm like, fine. Okay. Mind you, my endocrinologist is probably not very old. He's probably like, I don't know, maybe 50. I don't know. He's not very old. So he told me if you don't hear anything in a week to message through the portal, which I did. So I sent a message and I'm like, I haven't heard anything. Can you please check the status of this? They say, oh, we did send it. So then I called back to them and the next day, Wednesday, and said, did you get this referral? He told me a week ago that he sent it. Did you get it? And they said, oh, we just got it yesterday. So clearly I reminded them because somebody forgot or whatever the case may be. So they clearly didn't get it. So then she said, okay, we do have it, but the nurse has to review it for like, basically, how do you get in with the surgeon, right? Like he's an ENT, but he is a surgeon, okay? So he's an ENT that specializes in it. Now, there are just facilities that do removals, but most ENTs do it, okay? So, and he works, this is a big hospital. So they say we have to have the nurse review it. So I asked for a lot of prayers from my friends and said, please, can you please pray that we can get into this? I can get into the surgeon because I really just want to feel better. I don't want to have surgery, but I just want to feel better. So the next day they called. And so they called me and set it up and we were able to see him then on this week. So we saw him this week. The guy has to be like maybe 40. He's pretty young. I saw his picture online. And I was like, he cannot be very old. Well, he's not. Very nice. So basically, he went through everything and just said, yeah, we need to remove it. Based on the 2 scans you had, they're not my favorite, but they help us identify what's going on. He wants to do a 4D scan, so not 3D, 4D, of my thyroid parathyroid. So I do have to have that done in 2 weeks. But or next week, actually. I lied, next week. But it's also pending prior auth, so I have to make sure on Monday that they approved it. Otherwise, they have to push it out because otherwise they won't pay for it. And that apparently at 4D scan, I'm sure it's expensive like everything else in healthcare. So anyway, so he said, okay, I need to do the 4D scan, and because he wants to make sure that when he gets in there, there's no surprises. So he told, so he's telling me all this. He's asking me about my health, blah, 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 and my symptoms, which I tell him again. And I said, he's like, what about your voice? Any voice changes? And I said, well, yes, but I've had reflux that goes all the way up to my esophagus. So I have esophageal reflux. So it goes really high. So my voice changes when my reflux is bad. So I said, I think my reflux is bad. I haven't been taking my reflux medicine for probably 4 or 5 years. I don't know. So he's like, okay, so they do the little scope. It's a flexible, I don't know if is a bronchoscopy. I don't know. It's just this flexible camera they put down your nose, goes in the back of your throat. They can look down. The reason why he wanted to do that was 2 reasons. I asked him if he could check him and see if my reflux is bothering me. And because when they do the surgery, they are cutting by your vocal cords. There's one on each side, right? He thinks it's only this parathyroid, one of them. So it's an adenoma, which is a abnormal growth of your parathyroid, one of my parathyroids at this point. That's what they believe, right? One of them. So he does a little scope, and then he says, oh yeah, your reflux is bad. You need to start taking your medicine again, which I'm going to have surgery now. So I started taking it that day because I don't want to have any other problems, right? So I did start taking it because I always know when my voice changes that it must be my reflux, but thankfully I really haven't had any other symptoms. I always have symptoms, but that could be my parathyroid, it could be my body. Okay, I don't know. So anyway, he says the reason why he wanted to look as well, the second part of it was because those vocal cords are here. Sometimes with surgery you are intubated. It's a general anesthetic, so I'm fully put asleep, but he is cutting next to it. He's hoping only to cut and then only look on this side because right now it only looks like it's one of the 4 on the right side. But that's why he's doing the 4D scan, to make sure that it's not the both of them, because the ultrasound showed a 4 millimeter and a 6 millimeter, but it could be the back side of it or just the angle because it's just an ultrasound. But the 4D scan will the 4D scan will show him if it's the 2 on this side that are actually both have growths. So he did that because he wants to make sure that my vocal cords are okay, because if my voice is hoarse after surgery, is it my reflux or is it because they hit my vocal cord? And he said, if I hit, let's say, because you got to talk about the risk, right? So he says, if I hit one of this side, if I'm only cutting and looking on this side and I hit that one, it can be healed. And he said, we won't talk about how we do that, but if that happened, then we can find solutions, which I have read that. So then he said, it's not that you would lose your ability to talk. It was like, you just would maybe talk like this. And I said, okay, my husband might like that because I have a big mouth, but I wouldn't like that. And I don't want to lose my voice because I like to talk. So that's why he wanted to look and make sure it was my reflux. And it is my reflux, okay? So I did start taking my medicine. And so when he was talking to us, it's like, okay, so surgery is what we need to do. You're young. There is medicines we can give you, but they're very hard on your body. My calcium in my urine is high, so they're worried about kidney stones. And then I haven't broken any bones, but he said that doesn't mean that I can't. But I fell off a ladder this fall, and I didn't break it, or this winter, and I didn't break anything, thank goodness, because I fell very hard on my nightstand, against my nightstand, and then onto the floor. I really thought it might have broken something over here, but I had my DEXA scan. There's nothing broken. But anyway, so basically tells us, yes, surgery is it. We went over the risks, the benefits, all that kind of stuff that you normally do with surgery. I didn't sign my consent yet because I think you sign that the morning of, right? So he says, he was telling me why he wants to do the 4D scan. And he said it because it will really outline each one of my parathyroid glands. They're pretty darn small. They're like the size of a rice, okay? So we know that the one is bigger than a size of a rice. I would have to look at how many millimeters of rice is. But so we know that one of them is. But if he does the 4D scan and he sees there's another one, it's less surprise. It's less digging. It's less exploring when he's cutting, right? They don't want to risk doing anything more. So now with the surgery, he told me, which I kind of knew because I looked at research. So how they do it is they remove the one parathyroid. If that's it, the 4D scan says it's only one. What they do is they draw my parathyroid level and then they wait for the results. And in the meantime, they take that adenoma or your parathyroid that has growth or is misfunctioning, right, or not functioning correctly, that gets sent down to pathology. And I found out it's because I'm sure it is because they want to make sure it's not cancer, right? But also because make sure there's no other tissue connected to it. Make sure that they just have what they have. They don't want to have any other tissue. So they do that. So he said, the surgery it's probably total 3 hours that we're watching you and you're there. A lot of the time is getting you ready, getting you asleep, then taking that away, but then they're waiting for the parathyroid to come back, which takes about 15 to 20 minutes, and then they're waiting about 20 to 30 minutes for the results from pathology before they close you. Then if those are okay and your parathyroid drops to a normal level, he has expectation of what it's supposed to be, in that it drops that quick, then he will close up and we'll be done. And then they watch me for a little bit after and send me home. My surgery will not be the first surgery. He told me as a case in the morning, and then my surgery will be early afternoon, mid-afternoon. So they don't call you till the night before with your exact time to be there. So he's telling me all this, and then he tells me, that's why he does the 4D scan, and he says, okay, well, what he's talking to his LPN who came in at that time, and about schedule, and she says October, and he's like, oh no, wait, I had a patient, I just did a 4D scan, we got the results back yesterday, and I have to send them to there's the mother hospital that these patients we go to for like the best treatment in probably the world. It's one of the best hospitals in the world, which is mine is affiliated with that. But so that patient got sent to the big hospital. So he actually has an opening mid-September. So I know it's another 6 weeks. But at this point, I've been dealing with this for 9 years. We went over, obviously, if I have any symptoms with my kidneys, then I have to go into the ER and let my endocrinologist know. So the plan now is my surgery is mid-September. I've kind of told you about it. They'll watch me after. I'm pretty nervous to go home only because there is a risk of your calcium. Your calcium will drop. And it will drop significant, and your body will have to compensate. So they immediately put you on whatever dose he deems. I did message him after and say, I forgot to ask you how much calcium you want me to buy because I know there's different strengths, but I do know that I have to take calcium that day immediately. So he said, don't you worry about it. We'll send you home with the dose we want you to take. So he also went over the symptoms to watch for if my calcium is dangerously low and you go to the ER, okay? Because if it's too low, you can have a heart attack and die, okay? So, you don't want it to be too low. So, I'm nervous right now not about necessarily the surgery. I'm worried more about if I have a calcium drop. So, that's part 2. Part 3 is going to be, I will do some clips the morning I have surgery. I will do clips when I feel okay after. Maybe my husband will do a few, and then I will update you after, like a day or two after, and then I will so I'm going to do more because I want to share how this has gone for me, and then I'm going to do like a 2-week checkup after I see the surgeon 10 days after my surgery. So then I will do another update with that. So maybe my end of, or probably let's say October, I will do another video with how things are at that point because I want to update, and then I'll probably do a 6-month and a 1-year follow-up with you all because I just want for you to have a resource to go to, and hopefully then I know things will go well. I trust God. I know a lot of you are praying for me, and I truly appreciate that. I know things will be great, and I feel like God is using this as a life lesson as well. And don't just accept from a doctor that it's just slightly elevated. Your calcium is so fine-tuned by your body, it should not be elevated and it should not be low. And if it is, there's a reason and you should find out why. All right, thanks for watching.